Hello everyone, Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. Today I want to talk about the increases of technology and the burdens that it may place on our patients, all in the goals of profiting for the hospitals or for the physicians' offices. I do want to say that it's not that I'm against these profits. I just want to take a step back from where we're at and discuss, are these things actually accomplishing what we want them to accomplish? Is it worth it? Do we think about the barriers that we put in front of our patients to get the access to care that they need, et cetera, et cetera? So I'll talk a lot about this today, but as you can see, the title of this is Apps, Remote Patient Monitoring, Remote Therapeutic Monitoring, all have different connotation of what this talk is going to entail. So let's start with just apps. So if you go to a hospital system, we'll use Ohio State, for example. They have their own app system, likely connected to their EHR, where that's going to send you patient reminders. It's going to have you get online and access to see your medical charts. You can forward things, download things, yada, yada, yada. Which is all great. It's great to have a centralized location for all this medical data. But if you're not in that Ohio State network as a physician or a practitioner or whatever, and the patient wants to go see you now, well, not only does that physician may not get access without requesting access from the hospital system or having an EHR system that communicates, and there are some that communicate with one another, which is great, but that physician is going to have their own intake forms and stuff. So that physician's also going to have their own app, their own, things you might need to download, et cetera, right? So it's like, now the patient has two different providers with two different things that don't communicate. Is that actually accomplishing what we want to accomplish? It might be doing the right thing for per location, like the hospital's doing the right thing, the patient's practitioner, the physician's doing the right thing, but now we're adding another barrier to care that wasn't necessarily there in the first place. My argument to this is, in the past, patients would always need to fill out paperwork regardless, whether it be in the doctor's office or they, get it faxed over or mailed to them prior to. But when we start doing more and more things electronic, and we have everly growing population that wants to get away from electronics, or don't understand the new technology. As patients get older, they're less likely to keep up to date with the technological advances. And these are the patients that are usually seeking medical care, the Medicare patients. So are we actually, again, causing barriers to allow them to get the access to care that they need? I'll give you plenty of examples from my own practice where I have a app where I utilize to gather patient data that quantifies some of their pain scores, their promise scores, and some other metrics that are, good metrics for not only research purposes, but also reimbursement purposes in the pain management world. And there's other screening tools involved. Well, I've had several patients that say, like, well, I'm not going to do this. I don't want to do this. And, some patients have even come to my office and we've sit them down with a tablet and they've walked out because they don't want to do it. My argument, again, is always like, if this is a new patient office visit, you would have to do paperwork. Ours is electronically, and it's very easy. It's just going to take, it doesn't take any longer than it would if you fill out paperwork anywhere else. But, patients are very adamant about this. Sometimes we give the patient the option to do it beforehand. They'll get a message on their phone or into their email box. But to their point is, sometimes they're like, I just saw a physician. I did all this paperwork. I don't want to do it again. And they referred me to you. Why do I have to do this again? It's like, now I feel like the bad person, like I'm doing something wrong. But this is kind of like where we're going with this technology thing is, and these are barriers to care that the EHR companies aren't realizing, that these app companies aren't realizing. EHR companies only care about selling their product and make theirs the best. They don't care about the access to care for patients or how time consuming it is for physicians or nurses or the healthcare staff to navigate through that stuff. especially with all the clicks and checks and all that stuff that you have to do nowadays. And it actually increased our litigation risk, because if you don't click that, or if you did click something and you didn't really look, now it's documented in that system. So it's something that's very prohibitive of treating patients how we should be treated. And now on the patient side, do they have to download another app? Do they have to spend all this time to do these kind of things? It can get really frustrating for them. I've gone through my own questionnaires several times, and I know what it takes and how long it takes, but I get it. Like, there's some patients that are 70, 80 years old that don't want to do it, and they don't even have cell phones that are capable of doing it. They don't have computers at home. They don't have email addresses. All these things are barriers. So this is, in a sense, ageism, or ageist, where we're not allowing access to care to the providers that need it because of this technological advances. Now, obviously I'm not going to turn a patient away because of that. I'm happy to see them. I tell them, like, listen, we can see you. It's just going to it's going to take a lot more time, right? And now our meetings end up being 2 or 3 hours, an hour visit. And then it's going to take me another hour or so to do the office note, because I have to now translate all that information back in. It's prohibitive, right? So that's like the big portion of like intake forms and apps that we're doing. Now these companies that are heralding their apps, like, oh, this app will help you do this and track data more, and it can help your reimbursement if you add this code in. It's like, okay, great. For me to make an extra $30 to $60 a patient, that's awesome, right? And it's not every patient, it's only the ones that are Medicare or have the contracts, et cetera. But at what cost point to the patient, right? Like, this, now we're forcing more things upon the patient just so I can make more money, when we should be, in the totality of things, making our patients' lives easier, giving them the tools that they need to go live a healthier life without us having to look over their shoulder all the time. And that's a good transition into remote patient monitoring, where a physician or a practice will have a patient check their blood pressure, check their glucose, check their heart rate, all these kind of things at home, and upload the data and send it to the practice, where then again the practice will analyze it, suggest changes if needed, or they won't do any changes if not needed, but you still bill for it, and then you get paid for it. There's a lot of things around this and how it works and the intricacies of it. I don't really have all those details, but the point remains of my totality of this talk is, now we're adding more barriers to our patients, right? Like, now they have not another app for this remote monitoring, and they have homework now that they have to check up on themselves. Like, I totally understand this for patients that are very tough, hypertensive patients. I hate the word non-compliant, because sometimes the medications aren't active for them or don't work for them the way they need to be. If they're literally not taking the medications, that's another thing. But similarly with diabetes, like, if you need to do glucose monitoring for a reason, that's awesome. And I think we should be doing that to kind of see if we can tailor it. But like, to bill this every month or every 6 months, or I don't even know how the billing works, like, it gets a little ridiculous, because now you're adding several things. And what if one doctor is an endocrinologist checking the diabetes, and another doctor is checking the hypertension, and another doctor is checking this? It's like, now you have 15 different doctors. So our patient just sitting at home hooked up to monitors all the time and monitoring everything and uploading data. And, we're becoming into a society of not really talking to the patient and just looking at numbers and data. Physical exam and physical findings will remain the king of medicine when it comes to diagnoses. We can screen a lot of things with labs, which is great, screening can save lots of lives, and I truly believe that. But at what cost? I think this is the right idea. I think this is the right way to do things. My problem is, too many companies are taking advantage of the situation, coming down on doctors, and hey, do this, do this, do this. And again, at what cost? I mean, I would hate if I had to check my blood pressure, check my glucose, check my whatever else, and upload this data to different doctors every day, or even the same doctor a few times a week, like, just so they can make more money. And again, this isn't a bash on the physicians to find a way to make this a lucrative exchange for the time that they're putting in to look at these and monitor them and make adjustments. But I guarantee there are doctors out there that aren't doing any of that. They look at it and be like, okay, and make no adjustments. They still bill, in technicality, that's fraud, but who's going to stop them? Like, who's going to come back and say, oh, you didn't do what you're supposed to do? Another concept along that point is, can you double up? If I use one company for this and then one company for this and one company for this, am I able to build 3 times? Like, I don't know. And there's so many of these companies out there, and they're taking advantage of it right now because it's being reimbursed, and they just updated the 2023 rules saying that it'll be reimbursed again. But I guarantee in 4 or 5 years, it's not going to be reimbursed nearly as well, because we know that the government always cuts physician reimbursement year after year. We just got hit again with a 4% cut in our reimbursements. And what's going to happen then? Now you have this app that, might be only paying $4, $5 per patient. Yeah, it can add up, but, now you're doing all this extra work. Now this patient has these apps, all this stuff. So another thing to think about when we're putting our patients on the remote. If it's a patient that absolutely needs it, then I can agree with you. And I'll give you an example as we transition to remote therapeutic monitoring, which is more post-stroke, post-rehab, post-injury, back pain, knee surgery, shoulder surgery, okay? So remote therapeutic monitoring is some sort of analysis of you making sure that your patients are doing their physical therapy regimen at home. And my prime example of this is a patient that I chose to use this for. They are an amputee. They did not have a good experience with their physical therapy in their area. They live in a remote part of Ohio. And they said that the physical therapist they went to did not understand how to deal with amputees. The patient was still dealing with back pain and joint pain and overcompensation, SI joint pain, a lot of different things. So when they were talking, I was explaining like, hey, I think I have a solution for you. And go down the laundry list, and I tell them, hey, this is what I have for you. If you want to use this, I think you're the perfect candidate for it. Because they did not want to drive to physical therapy anymore. They did not want to waste their time. They didn't want to drive 2.5 hours to come to Columbus and get their therapy done. So this way, at least they're sent home with this app, unfortunately. And like I said, I already have apps. I already have these things. So I felt bad. And I told her, like, listen, I'm sorry this is going to have to happen to you, but they're 2 different platforms. I'm going to work my best to get these platforms to talk, but it's just the reality is. And thankfully, they were okay with it. But over the next month, now I'm going to be able to monitor how much they are doing their physical therapy. The way it works is they open up their app, the images will come up, videos will come up of how to do the exercises. They do them. Every time that app is engaged and they're doing it, it will track their data. And after the 15 minutes or 20 minutes are up for the day, they will answer questionnaires, and then that data will be uploaded to a care specialist. That care specialist communicates with me how they did, if it was easy or hard, and then I can make adjustments as needed. So that is an example of if and when it's needed, I completely get on board. But for these companies to come to me, it's like, oh, you can make an extra $30 a patient, $60 a patient. It's like, why? Like, I get it, but is this the best thing for the patient? If it's truly working and if it's truly what they need, I'm fine with that. And to get compensated for the analysis of what I'm doing, yes, absolutely. But, also a lot of these patients are referred to me from physical therapy. So why am I going to undercut my referral sources of physical therapists when these are therapists that I work with and I trust their judgment and I trust how they work because I've been through their offices? it's counterproductive as a society as a whole of how we can treat patients in pain. Um, there are different examples of remote therapeutics. You could do like post-stroke rehab, speech rehab. So some of these things do make sense to me. Um, but I think my point remains as what's the cost if we're going to continue. Like a stroke rehab process could involve physical therapy, speech therapy, swallow therapy, occupational therapy, upper hand coordination, a lot. It could, are they going to be separate apps? It's all going to be one platform? Are you have different physicians chasing after it? I don't know. And I think that's the big thing. I just like to look at this in a weary eye. I've actually made a couple posts about this. I made one on LinkedIn. I made one on Twitter about it, about how this is only accessible to the patients that are tech savvy, are rich enough to afford these kind of phones, and or tablets that can access these things. It can be uncomfortable for some patients, especially the patients that don't understand how to take their blood pressure appropriately, or don't take their glucose appropriately, or check other things appropriately. There's a whole set of social ineptitudes that the device companies aren't realizing. We have such a population health problem. This is the negative effect of that, right? Like, we're not doing things. The only people that are going to get access to care like this are the ones that are, unfortunately, not in the poverty line. The ones that probably need the help the most aren't going to get it. They're not going to get that monitoring. And we already know that for several reasons, populations like African Americans who have a distrust in the medical field because of years and years of abuse and downplaying symptoms, are they going to want to be monitored by their physician more? Like, isn't that counterproductive of what we're trying to do for our patients? I just wish there's better resources. I think this is a good idea. I think it's overshot. I think people are trying to take advantage of it, and that's the way I see it. I'm not necessarily saying I'm right. I just would have you guys really question, is this the best thing for my patient? And if you feel like it truly is, then you can do it. Then you should do it. But you're going to do it if, give or take, if I'm saying you should do it or not. But I want you to think about these things, because if you're not thinking about these things, then you're doing a really selfish thing. This is about patient care. This is about getting them healthy, getting them living a healthier lifestyle, living a healthy life to achieve the goals that they want to achieve. I'd be interested to see the data that unfolds from this. The data that's always presented to me from the app companies is like, oh, we've seen a 50% reduction in this, 50%. How do we know? It's only been active for like 2 years. I'd like to see some long-term data about this. And are we selecting? I mean, what happened to all the dropouts? I guarantee there are dropouts. After about 2 weeks, the drop-off rate about any change of lifestyle is significant. So what happens then? It's not white and black stuff here. There's a lot of gray area. I'm excited to see where this goes. I think it could be a home run. And I think if the platforms learn how to work more seamlessly, it could be a game changer in how we treat patients, without unnecessarily monitoring and doing all the stuff in a negative way that's affecting the population health and stuff. Maybe I'm an idealist. Maybe I see this perfect picture of things, but what I do know is when patients come to my practice and they don't want to see me because they don't want to fill out online paperwork, or they get mad because they have to give up their email address and cell phone number and address, people are going to be very, very hesitant to do that. Maybe not in big cities, where a lot of these things can really take off, but in rural parts of the country, which, as we know from election results and stuff that a lot of rural people have a different view of the world than the cities do, right? So it's not in a negative context that they do. It's in a context that's a reality and that's fine. I truly believe in the individual right. I truly believe in those kind of things as long as you're not affecting a larger population. But these are the type of people that also gonna be like, nah, I'm not gonna do this. Or no, I'm not gonna come see you because you're making me do this. Yeah. So anyways, that's, my big, let's put a little hashtag on this and asterisk on this, and let's see what the data comes out as we continue to do this. I'm excited to see it on the rehab side because I think that post surgical patients, I think post injury patients can really benefit from this. And I don't necessarily care to make the extra money on it as long as the patients are doing it and they have a regimented system. I think that's going to be the best thing for the long term. And listen, maybe that's the same thing for remote therapeutics or remote patient monitoring too. I have no idea how to, because I don't do enough of that, but I'm excited to see it. Hopefully I didn't discourage you from doing this. I just want you to ask better questions. Why are we doing this? Is this the most beneficial thing for our patients? Is this the direction we want to go in medicine? Are we making more barriers to healthcare access than we need? So anyways, I hope you guys find this interesting. I hope you find it useful. If you do, please share, please subscribe, drop me a comment, ask me some questions. If you have a topic that you're interested in, please send me a message. I'd love to talk to you about it. In the next few months, hopefully before 2023, but it might be in 2023, I'm going to start a layman's term pain education thing. And it'll be on the YouTube channel as well, where I kind of talk a lot about what pain is and the misconception of pain, or what it means if pain's all in your head, or how our cells change, and kind of break it down for patients. So I bet a lot of people that are in med school and residency will find this really beneficial as well, and how they can start talking to their patients or even their attendings, because I was having lunch with a surgeon yesterday and he didn't understand chronic pain at all. So I'm like, all right, let's break this down. And I had to sit here and explain to him. He's like, wow, I had no idea that's what actually goes on. So, and the same thing, I have no idea about general surgery. I mean, I know the basics, I know the anatomy, but if you were asking me to go do a gallbladder surgery, I would be very in over my head. I could probably figure some stuff out, but that's why I don't do it, right? I'm not a surgeon. I don't do those kind of things. So, anyways, I do hope you guys find that useful. If you do, then I would encourage you to share it with your patients and family members and everyone else that might be dealing with chronic pain. So anyways, I hope you guys have a good weekend, and we'll talk to you soon.